What is hair transplant? Let's talk about the hair transplant today. FUT or FUE. There are two surgical methods by which hair can be removed from the patient's scalp: follicular unit transplantation, follicular unit extraction. Regardless of which technique is used to remove the hair, the method for transplanting each of the grafts is exactly the same. Let's first talk about follicular unit transplantation, that is FUT. People suffering from androgenetic alopecia, commonly referred as pattern baldness. Patients will keep an area around the back and sides of their heads which is not affected by the balding process. This area is known as the donor region. When hair is removed from the donor region and transplanted into an area of thinning or baldness, the hair will keep the characteristics of the area from which it came. This means that the hair will remain unaffected by the balding process in its new home and will stay on the patient's head for the rest of their lives. No special medication or shampoos are needed to maintain the transplanted hair. The patient will be awake throughout their hair transplant and will feel no pain. A local anesthetic is used similar to that used for dentist patients. Once removed from the donor region, each graft is individually prepared for transplantation, and at the same time, small incisions are made in the recipient's areas where the new grafts are to be transplanted. Hair graft is a naturally occurring group of hairs which can contain between 1 and 4 hairs each on average. There are 2 hairs in each graft. 4,000 hair crops can be transplanted in a single day's procedure. Now let's talk about follicular unit extraction, that is FUE. If the patient is going with FUE procedure, then in most cases the entire scalp must be shaved in advance of the procedure. FUE technique only allows the technician to take every second hair graft from the safe zone. This method of hair transplantation is minimally invasive procedure that involves using small circular punches to remove the individual follicular units from the back of the scalp and then re-implanting the harvested follicular units back into the scalp in the balding recipient areas. The tiny incisions left behind after follicular units are extracted will heal completely in few days. 3 months after the procedure, you should begin to notice new hair growth. After 6 months, you should notice significant regrowth, at which point your native and transplanted hair will continue to grow naturally. A properly executed hair transplant should involve very careful planning with a large team of hair transplant technicians, nurses, and should only be carried out by qualified consultant surgeon.